Good evening, class. Today we're talking about advocating for a patient. And this evening we have a new admission that came in, and the patient is 28 weeks pregnant, was examined by the attending physician who said that the woman has a lung cervix and has recommended this woman to be discharged home on bed rest. So I want to say that bed rest is a good idea, but if we have that bed rest in the hospital, will give us the opportunity to carry out all the testing before deciding on how safe it is to send this patient home. So bed rest sounds like a good idea, but should be in the hospital where complete preterm testing is done to ascertain the safety of the unborn child and the woman. Agreeable that Mrs. P cervix is long and indicative of safety, but that's not enough to send her home. So sometimes things change, and in some situation too. Historically, Miss P has two previous preterm birth at 32 weeks and also at 34 weeks, respectively. The current gestational age is low and requires further investigation, such as transvaginal ultrasound, that gives more information, such as maternal, fetal, and atomic abnormalities. So it is very important to keep this woman in the hospital to carry all this tests on before deciding on what next, what is the next treatment plan that is safe for her and for the baby. So a transvaginal ultrasound test can reveal the amount of amniotic fluid and fetus weight. Finding out the fetal well-being before discharging the patient to bed rest at home is a safer practice. So the treatment plan. The treatment plan is to perform a physical examination, which you are already done, and monitor fetal heart rate and uterine contractions. Also, the collection of cervicovaginal sample for Streptococcus group B is very important. Chlamydia, gonorrhea, gram stain for bacterial vaginosis, urinalysis, culture, and sensitivity. Amniocentesis should be done also, and fetal fibronectin is necessary treatment plan. So other diagnostic workup include ultrasound to check for weight, placental location, fetal presentation and lie, amniotic fluid volume, and transvaginal cervical length, which we have already confirmed is long. So after the testing is done and it is confirmed the woman is in preterm labor, then the necessary steps for treatment can begin, which is to administer a steroid such as betamethasone and tocolytic agents such as magnesium sulfate to the mother. Magnesium sulfate has a protective effect on the fetus brain and prevents cerebral palsy and other neurological conditions associated with preterm delivery. So administration of betamethasone reduces the rate of neonatal respiratory complication. So I am in support of having this woman stays in the hospital for all this testing that I have mentioned. And when we have the result, then we can take the next necessary plan for this patient. And if the woman labor is not progressing and all that test comes negative, everything looks good, then we can send the patient home and educate her on things to observe. And then when it happens, she can come back and then the bed rest will really make sense at the time. Thank you. And attached is more details of my presentation. So thank you and have a good day.